Ever thought what exactly is an athlete's heart or an athletic heart syndrome? Ever wondered if there is any pathological reason behind it? Well, that's exactly what we're to find out today. Hi guys, my name is Priya. I'm a sports physio. I've been working in the field of cricket since last 3 years, working in the field of sports since last 5 years. Back on Feet is a small venture of mine in the hopes to give back to the society what I've gained from it. So if you like such videos, do not forget to subscribe to the channel and hit the like button. Alright, now without further ado, let's get into this video. Alright, so I have divided this video into 5 major categories. First is what is your athlete heart or athletic heart syndrome, that is the definition of it. Second are your signs and symptoms. Third will be the cause behind it. Fourth will be your diagnosis, how is it diagnosed. And fifth will be your differential diagnosis, that is which is the disease which should always be differentiated if you are ever considering it's an athlete's heart. Alright, so now we'll go for the first topic. Alright, so we'll go to the first topic of this video, that is the definition of athlete's heart. Athlete's heart or athletic heart syndrome is a non-pathological condition commonly seen in sports medicine. I repeat, it's a non-pathological condition which is commonly seen in sports medicine, in which there is an enlarged human heart and the resting heart rate is lower than the normal. Okay, this is commonly found in endurance athletes but can also be found in heavyweight trainers. The second part of the video is signs and symptoms. Athlete's heart often does not have any physical symptoms, though an indicator can be consistently low heart rate, that is resting heart rate of course. Alright, the athletes usually do not even know that they have this condition unless and until they undergo specific medical assessment. If we talk about the signs, the people or the athletes who have been diagnosed with athlete's heart syndrome usually have 3 major signs. One is your bradycardia, that is your lower heart rate, resting heart rate at 40 to 60 beats per minute. Second is your cardiomegaly, which is enlarged heart. And third is your cardiac hypertrophy, that is enlarged or thickening of the walls of the chambers of the heart, usually the left ventricle. Also, an S3 gallop can be heard on stethoscope in some of the athlete's heart syndrome. S3 gallop is nothing but a sound which has been produced by the irregular blood flow due to the diastolic pressure in the irregularly shaped heart. Alright, so these 4 are the major signs which can be observed once the patient has been diagnosed. Pre-diagnosis, there are usually no symptoms which the person will complain to you. The third section of this video is the cause of athlete's heart or the athletic heart syndrome. Like I said in the start of the video, this is a non-pathological condition. Well, if there is no pathology behind it, why does it happen? Well, the answer is very simple. Like the word used, it is athlete. It usually happens in people who work out at least more than 5 hours per week and are more into endurance training rather than your static strength training. Okay, so that is the main thing which you need to keep in mind. Now, what happens is whenever you're going for any endurance training or you're working out for too many hours or longer durations, your heart needs to pump out more blood in return to meet the oxygen demands of the body. Okay, whenever you're working out, your muscles are working, that means they need oxygen for the glycolysis or all the other procedures to make ATP, which is your energy. So for that to happen, your heart needs to pump out as much blood as possible. Your brain keeps giving it signal to get out more cardiac output. Now, your cardiac output is the amount of blood your heart pumps out per minute. Okay, amount of blood which the heart pumps out per minute is your cardiac output. Stroke volume means the volume of blood your heart pumps out with each beat. Okay, it is volume of blood heart pumps out with each beat. So basically, cardiac output is equal to stroke volume into heart rate. Now, if your heart rate can only go up to a certain limit, okay, every person has a higher cap of heart rate. They cannot go beyond that. So To increase your cardiac output, the only variable which can actually be altered is your stroke volume. Now, for change your stroke volume, what can be done? Whenever your heart gets bigger or it has a thicker walls, it can contract more forcefully and put out more blood. That is, it can increase its stroke volume. So, if a bigger heart contracts compared to a smaller heart, or if a thicker heart contracts compared to a thinner heart, what happens is the blood flow which is coming out of the thicker and the enlarged heart is more than the smaller regular heart. So basically, your athlete's heart is a physiological response to the stress which we put on our body by working out more than 5 hours a day, 5 hours a week. Okay, so that is basically the cause behind your athlete's heart. Athlete's heart is absolutely a physiological adaptation to the stress which comes with the physical conditioning and aerobic training. The fourth part of the video is your diagnosis. Now, the diagnosis of athlete's heart is usually a chance diagnosis, a diagnosis which you usually stumble upon during your regular medical assessment or during a medical assessment for any other condition, because like I said, patient will not have any symptoms. So what you do is whenever you go for any testing like echocardiogram or chest x-ray, you can see a possibility or a enlarged heart on the results. When that happens, you go further into your investigations to decide particularly that yes, this is an athlete's heart and not any other condition. The reason behind this is there is a very specific disease which needs to be ruled out, which can be fatal for the person. This brings us to the fifth and the final part of this video, that is differential diagnosis. Which disease should always be differentiated if you are considering an athlete's heart? That disease is named as hypertrophic cardiomyopathy. I repeat, hypertrophic cardiomyopathy. What this means? It means that there is an enlarged heart. Now, this enlarged heart is very different than your athlete's heart, which is also a different type of an enlarged heart. This enlarged heart or this disease, that is your hypertrophic cardiomyopathy, can actually be fatal. So you always need to differentiate it. How do you differentiate it? If you go for an ECG of rest of your athlete's heart and your hypertrophic cardiomyopathy are similar. They will show similar abnormalities because of the enlargement in the heart. But in athlete's heart, what happens is these abnormalities in the ECG become normalized when they start exercising or whenever an exercise is started. So the biggest differentiation which you can do for your hypertrophic cardiomyopathy and your athlete's heart is exercise stress testing. In these testing, there are variety of types which can be done, variety of protocols which can be followed. They are usually treadmill based but can be done in different ways also. Okay, so these are the main differentiations which you need to do. Alright guys, so that's it for this video. If you like the video, do not forget to hit the like button, and if you're not subscribed, please subscribe and turn on the notifications. Next time we are thinking of considering the topic of hypertrophic cardiomyopathy. Let us know if you would like the video on that. If so, keep a yes in the comment section and we will give the video. Alright, so I'll see you guys next time. Bye.